Can be administered in a various routes, maybe from the head to foot, various routes, or it may differ from according to the disease conditions and different types of the age groups and the severity of the disease condition. We will apply the vascularity. This class we will see clearly about this. We'll see about the routes of drugs administration. It's very important in what route we are giving, why we are giving. As a nurse, we have to know there are the different routes of drug administration for the different kind of the patients. So, external route, it's a very simple route in a oral injection. What all the drugs are given in orally? Paracetamol, coated tablets, vitamin tablets. What is the benefits? Is surface route, very easy, so economical. It is very safe, it is non-invasive. Only children have. Sometimes they are afraid to swallow the medicine. Otherwise, all the people, it is normal to take the medicine without any pain or invasive procedure. Parenteral route, intestinal route tissue to the blood, NG tube. Through the NG tube, we are sending the food and medicine. Then injections. Let us see, before injection, we can see the inhalation. Some of the drugs are given as a form of inhalation, like gaseous substances, salbutamol, butylene, budocort. So this is will be liquid form of, when you vaporize, these drugs will be acting upon the respiratory tract. And transdermal, some of the transdermal like patches will be coming, nicotine patches or progesterone patches. So those slow amount of the drugs through the skin, it is getting absorbed through the tissues and it is going. And then transmucosal, it will be rectal. And the topical is the ointment form we are giving as a topical. The very important one is called the injections. So what is the types of injections are there? There are various different types of injections are there. It is called the subcutaneous. Subcutaneous, mainly you can see some of the vaccines like measles, MMR given as subcutaneous. If a medicine is a form of insulin is given as a form of a subcutaneous. Intramuscular. Intramuscular, many injections, antibiotics can be given, painkillers can be given. If more than 10 ml, we cannot give intramuscular. That is the reason we select for the IV. Okay, intradermal. So intradermal, some of the vaccines are given as a intradermal form. Okay, BCG and other vaccine. Intravenous route, it's like a bolus form. Its administration as a bolus. It's like a 500 ml or 1 liter. It will be slow through the infusion pump. They will do the calculation, hour per hour calculations, and it will be going. And intraperitoneal. There is a intraperitoneal. It's like an injection or the large surface area of the abdominal peritoneal cavity. Intrathecal is injections is a subarachnoid space where the CSF is there, where there is a circle of Willis floating in a subarachnoid space, mainly to prevent some infections and other things. To prevent meningitis, we are giving some of the substances to the injection to the subarachnoid space where the CSF is there and circle of Willis is floating in the CSF. And intra-articular, there is an injection to the joints, mainly the injection given for the arthritis patients. And intra-arterial, there is an injections given to the arteries. Intramedullary, it is like an injection to the bone marrow, especially for the bone cancer and severe pain, the intolerable pain. So there is an injection given directly to the bones. So that is called the intramedullary. Okay. Other than that, there are the drugs are delivered in other form. Like Accusert. It's like Accusert is called the ocular administration. In the eye drops we are getting. Progestrate is like we are giving it is in an intrauterine. We are giving. And transdermal patch. It is to the skin. When it is putting in the transdermal patch, it will to the skin and it is going to the bloodstream. And computerized miniature pumps. Example, insulin is given in a form of a miniature form. If you said every day in a amount it will be delivered. And liposomes, it is like a cancer cells. And monoclonal antibodies through subcutaneous they are giving. So these are all the very rare routes, but also these routes are used in our day-to-day life in the hospital setup. Okay, overall that, what are all the rights? We have seen as a nurses we are doing various routes of administration. What are all the rights? The rights of drug administration is a very vital important one. The long administration, wrong patients if you do, you will be legally will be sentenced to the punishment according to the seriousness of the patient's condition, especially in foreign countries like Saudi Arabia, even in India too. The rights of the drug administration is a right to the patient right to refuse. No, I don't want to take the drugs. You have to accept it. And right to approach and right patient. It should be a right patient. How do you find out the right patient? Fatima Al-Fifi will be there. So many Fatimas are there in a Muslim area. The hospital is there. Better right patients. Once you check Fatima only and check their ID number, Pitaka or the card number, and the right drug. Is it a correct drug? Look alike, sound alike drug should be avoided. Right route you have to follow. Is it IM doctor is written or IV doctor is written? Right time, it is after food or the before food. And the right dosage, it is how many ml, 50 gram or 500 milligram. And the right reason why it is, you have to reason, question itself, okay, this is the reason. And then the right assessment data, is it all the data are correct? You have to check the files once. And right education. So drug is insulin has been given, immediately you take the food, otherwise it will be going for hypocalcemia. Or what you have to do, what is the purpose of the drugs? You have to do it and do the right response to the patient and right documentation. Before 5 rights, 6 rights, 7 rights was there. Now it's like many rights are increasing. 12 rights like that, it is increasing. So you have to put right approach, right to refuse, right to educate, right assessment. So this is about the different routes of drug administration and the nurse's responsibilities in giving the right drugs to the right patient. It is called the rights of the drug administration. Thank you.